Okay, friends, welcome back. We just talked about normal breath sounds. Now we're moving into the sounds that make nursing students question their sanity. Wheezes, Rhonchi, pleural friction rubs. And honestly, once you understand what's causing them, they're not nearly as scary as they seem. I don't memorize these sounds. I ask myself one question: what is causing the sound? Because once you know the cause, the answer usually becomes obvious. Let's start with wheezes. Wheezes are high-pitched, musical, almost like air squeezing through a tiny straw. And honestly, that's exactly what's happening. The airway has narrowed. Air still wants through, but now it has to squeeze through a smaller opening. Asthma, bronchospasm, COPD. These are all situations where wheezes can occur. So when I hear wheezes, I immediately think narrowed airway, every single time. Here's how I remember it. Imagine trying to blow air through a coffee stirrer. The opening is tiny. Air can still get through, but it sounds different. That's a wheeze. Okay, friends, let's see if this is making sense. A nurse auscultates high-pitched musical sounds during expiration. Pause here and think about what findings should come to mind first. I'll give you a few seconds. Ready? Narrowed airways. Those sounds are wheezes. And wheezes make me think airway narrowing every time. Now let's talk about Rhonchi. Pronunciation, Rhonchi. This is one of those words that sounds way more complicated than it actually is. Rhonchi are coarse, low-pitched. They sound wet, congested, like mucus is hanging out where it shouldn't be. Because honestly, that's usually what's happening. When I hear Rhonchi, I think secretions, mucus, junk in the airway. And here's a test tip. NCLEX absolutely loves this. Rhonchi often improve after coughing. Why? Because coughing helps move secretions. If the mucus moves, the sound changes. And that clue alone can help you identify Rhonchi on an exam. A nurse hears coarse, low-pitched breath sounds. The sounds improve after the patient coughs. Pause here and think about what breath sound this describes. Ready? Rhonchi. Because Rhonchi are often caused by secretions that can move with coughing. Now let's talk about the breath sound that nobody forgets once they hear about it. Pleural friction rub. This occurs when inflamed pleural surfaces rub together. And honestly, the name tells you exactly what's happening. Friction, rub. Two irritated surfaces moving against each other. This is not a normal finding. It often indicates inflammation involving the pleura. And unlike Rhonchi, coughing usually does not make it go away. Because the problem isn't secretions. The problem is inflammation. Listen, this is important. Most students try to memorize crackles, wheezes, Rhonchi, pleural friction rub as 4 completely separate facts. I don't. I think about causes. Crackles, fluid, wheezes, narrowed airways, Rhonchi, secretions, pleural friction rub, inflammation. And suddenly respiratory assessment becomes a lot easier because you're understanding, not memorizing. Let's lock this in. Crackles equal fluid, wheezes equal narrowed airways, Rhonchi equals secretions, pleural friction rub equals inflammation. And remember, if you understand what's causing the sound, you'll remember the sound. That's the cheat code. In the next section, we're tackling voice sounds. Bronchophony, egophony, whispered pector illoquy. And yes, that's the section where your patient suddenly starts sounding like a goat.